Okay, we're live.
Hey guys, it's Dr. Emer. We're in West Hollywood. Today's a great day, very busy, and we're doing little filler tweaks. And here's what I like to talk to you guys about, because fillers often, what I'm seeing on Instagram or online, is people are doing like a lot at once and giving these like substantially unnatural looking results. We treated this patient before like a month ago or so and did a little bit. Now it all settled down. We see him back, and you can see if you take a look, he's got a nice chiseling, a nice defined cheek, a little bit in the jawline and chin, and it's subtle in the lip. He just looks very good. So now what we're gonna do is go a little bit further, do a little more enhancing in his chin to bring this out a little bit, a little more at the angle of the jaw, and then we're gonna soften the lip, give him a little more volume at the bottom because it really fits his overall look. We're gonna use Radiesse on the bone for the bigger areas, so we're gonna go directly onto the chin, right down to the bone, and do a little bit. And remember, over time, if you do small amounts, it looks so much better long term. So that's what our goal is. We're just doing very subtle bits and building that out so that it looks much more natural for him, and it's not a drastic change for anyone around him.
Why Radiesse?
Well, Radiesse is really good because it can go on the bone and give a longer lasting outcome. Hold right here. I'll do that. There. All right, she's good. It can give a longer lasting outcome there. Remember, Radiesse is made with calcium, not hyaluronic acid, so it has more substance to it. So areas like the jawline and the chin get a little bit more of a result, a little bit more of a substantial result with the Radiesse, which is what we want. And sometimes you have to build the cutaneous lip area, which is above the chin right there, to get a little more contour. Now we're going to turn him here. We're going to focus, look up just a little bit, right in the edge of the jaw, to make sure you're watching this, okay? Right here. Yeah. Grab a Q-tip if you can. We're going to go right at the angle of the mandible. We're just going to do a teeny bit right at the edge of the jaw, because I want this area to pop right at that 90-degree angle, because that's what he's going to see from the side when he's taking pictures. Perfect. So now we're going to move to the other side. Rotate.
How does it feel?
Not too bad.
That's really
What are
good.
you looking for? Tell everybody what you were looking for.
Okay, so more masculine kind of jawline. Nothing that looks too obvious, though, as Dr. Emer was saying. So something that's a little more subtle and just go over time to kind of grow it and make it look
Gradually build.
Yeah, gradually build and make it look good.
But you like having a more angled jaw.
Oh
right?
yeah, definitely.
Yeah, and it works really good for his face, which is very structured. So again, you guys got to customize it. Some people is more of a softer jaw. Some people it's a little bit more of the angle. With him, we're going to actually create a little bit on this 90-degree angle. Try not to run too much. Just hold flat. Great.
Do you inject Radiesse on bone or above it?
Depends. In some areas we do it in both, and some we don't. Here we're doing a mixture of both. Okay, some signs. And on the chin, I showed you guys that's typically always bone.
Dr. Emer, do you do liquid rhinoplasties?
We do. I've been on the doctor's show twice for that, so it's on my YouTube channel. So you can see here we're just building out that angle slightly. I don't want to go too far forward because I really want to keep the separation. I'm going to do a teeny bit more onto the chin, just a little, because it's going to go down slightly.
How long does the swelling last?
Usually a couple weeks, maybe a few days, but I always tell people give it a couple weeks before deciding. So let me see, bite down a second. So you can see when he's biting down, relax, bite down again. The angle is very defined. The one side's a little bigger than the other. So let's go over here and give him just a little bit more. Turn this way for me. Find right at the angle. Let's give a little bit more right at that angle.
Hi, James. Yeah, this patient is coming in for a touch-up.
Yep, this is a touch-up procedure, mild improvement there. So that's all done now. The chin and jaw. And now we're just going to do very subtle to his lips. He already has nice lips, but you know, some people like a little bit more. So we're just going to do very subtle using Juvederm Volbella, which is a really subtle, softer filler. I really like it, especially for men, because it doesn't look like much is done. You see, we're just doing so little. I call this like the chapstick filler, because this is just hydrating, guys. You don't want to look overdone.
Dr. Emer, can someone get chin filler if they already have a chin
Of
implant?
course, it's one of my favorite questions. Yes, you can. And I love doing it because the chin implant gives the volume. A little defining in the upper part here. The chin implant gives like the structure and the foundation and a little bit of volume, and then the filler kind of enhances the rest. Not going to do too much on the upper, just a very little, 2 pokes in the midline. That's a very small needle. And then the last part on the upper, on the other side. Doing a pillar technique, just a small amount.
What is a pillar technique?
Pillar techniques where we come in from a different angle, from a vertical angle rather than a horizontal angle, although here I'm going to do a little horizontal angle there. Alright, so now let's take a look, let's clean him off. It's going to smell terrible, but it's good for him. We're going to massage, make sure everything's really even, everything's on the bone, it looks nice and structured. And again, that's just a little touch-up, not overdone. Want to do an Emer reveal?
Yeah, let's do that.
Just tell them what the Emer reveal is.
Okay, so we're gonna flip the camera and then you're gonna look at your results. Yeah.
You're going to tell us, you're going to be shockingly amazed.
Are you ready?
I'm ready, yeah.
All right, let's do this.
So you're going to grab the camera from her.
Okay.
Yeah.
This one right here.
Look straight, always raise
it's
this,
on, I'm
always
on.
hold it up. You're on live. Look above. Look at
Perfect.
yourself, and what do you think?
Amazing.
Take a look to the side. Angle defined. Lips just slightly plump. Don't look unnatural. And take a look at the chin.
It's perfect.
Much more contoured. Balances out your high cheekbones. Now look straight and hold on this way. Bite down. You could see that definition. Come in a little closer so you can see it. Kind of look right here. Bite. Turn this way. Bite down a little bit. See the definition?
Yeah.
And then turn that way. See right there?
Yep.
Perfect. So that is, so now we'll show them with the mirror.
Okay, I'll
So
take
that
this
you can
from
see
you.
a little bit from a further away, and now you get the full view. Male facial sculpting using a combination of semi-permanent filler like Radiesse to build structure and definition on the jawline and chin, and a softer filler, Vicross technology, Juvederm Volbella to the lips because we want a very subtle, natural look. Now you sit under red light.
Ice first, no. Ice first a little bit.